talking about hot topics in HIV infection in 2015, I think we should focus first on the prevention, because the data that were obtained with the two trials, the Hypergay study conducted in France and the PROUD study conducted in England, show that there is a high rate of protection of pre-exposure prophylaxis. So I think that with two trials that were discontinued by the DSMB, it's time for the EMA and especially for Gilead to file to EMA for the registration of Truvada for pre-exposure prophylaxis. When we talk about patients with HIV, or those who are already infected, I think that this year has represented in all the guidelines a switch in the prescription, since integrase inhibitors has become the drug of choice in most antiretroviral guidelines all around the world. This is due mainly to the evidence-based medicine, since especially dolutegravir has shown superiority when compared to darunavir and when compared to efavirenz. So this message was received by the writers of the guidelines, and so they have completely changed the guidelines. And in most of the cases, they have decided to downgrade efavirenz from first choice to alternative, from recommended to alternative regimen. The last part is not absolutely the less important, because it's the problem of HIV-HCV co-infection. What we are seeing now is that we have the possibility to heal a disease that is more severe in co-infected than in mono-infected, because it has a more rapid progression time. But for a problem of cost, we could not have the access of this treatment in many of the patients. So it's important that infectious disease specialists focus their attention in this year, I think, on these three main topics, and to understand what we can do as advocates to increase the access to treatment for HIV-HCV patients, especially for HCV, in order to treat also patients who have a moderate fibrosis, let's say F2 of fibrosis, while now in most of our countries we could treat only F3, if not only F4 patients, so very, very advanced patients.